Okay, now we'll begin to study about common language in study of anatomy. In the course of you study the anatomy, we'll use some language, and this language only to use the anatomy. The first language is anatomical position. Anatomy position. First, what's anatomy? Anatomical position means you see the left picture, and this is a girl, and this position is anatomical position. Now, first, I'll describe what's about anatomical position. First is human being, and this body is assumed to be in erect position. First is stand up, and it's erected, not sit down, not lying. It's erected position. And the face, you see the face forward, and the toes, you see the toes directed forwards. And the upper limbs, you see the left and the right upper limb hanging by the side of the body, hung down on two sides of the body and close to it. And you see the palm. The palm face forward also, not face medially, not face backwards. It's facing forward. It's difficult. It's different with the normal. Okay, this position is anatomic position. And what's the purpose of this anatomical position? And the purpose is to describe a body. In different position, the direction is different. For example, some patients, when they go to the hospital, they are lying on the bed. So the direction is different with the erected position. So for the common purpose, we name this one is anatomic position. In the future, we study all the body, we study all the organ. The direction is according to this anatomic position. You see, okay. And now I'll introduce about the terms of direction. According the anatomic position, then we'll name some directions according the anatomic position. So you should know the anatomic position, then you know the normal direction. The first pair term of direction is superior and inferior. What's superior? Superior means the structure of the organ is very close to the head or to the superior part, you see. And inferior, opposite direction, near to your foot, the base of your foot. This is inferior. And another name, superior, is carina. Carina means the skull, near to the skull. And inferior, another name is caudal. The caudal means tail. The tail, some people's side, the people have no the tail, but you should know we have coccygeal vertebrae. This one is our tail. And human being can stand up and can walk. It's the difference with the other animals. Other animals, for example, the dog, the cow, they will walk by the four limbs. So the tails on the back, on the inferior part. Okay, so the inferior, another name is caudal. Okay, for example, you see eye and mouth. Which one is on the superior part? Yes, the ear is superior to the mouth. It seems the mouth is inferior to the ear. Yes, it's a difference of superior and inferior. We use the two terms to describe the organ or structure on upper part or on the lower part. The second pair is anterior and posterior. What's anterior? Anterior means the structure is closer to abdomen, anterior part or abdomen, and back, near to the back is posterior part. So anterior, another name is ventral. Posterior, another name is dorsal part. Now I give you an exam. Nose and ears. Which one is on the anterior part? Yes, nose is anterior to the ears, and ears is posterior to your nose. So this pair term is used to describe the location anterior and posterior in front, the front or the back, ventral or dorsal. The third pair is medial and lateral. What's medial? What's lateral? First, I'll give you a line. You see, it's our face. In the middle, I'll draw a line, and this line will pass in the middle of the anterior part of your face. So this median line will divide your face into equal left and right part. This line is median line. And if a structure close to the median line, we name is medial. If the structure far to the median line, we name is lateral side. For example, the eye and the ear. Which one is on the medial side? Yes, the eye is medial to the ear. It seems the ear is on the lateral side of the ear. Okay. The fourth pair is superficial and deep. As these two pairs, this pair term is used to describe the depth, D-E-P-T-H, the depth of the structure, the distance to the skin. For example, is our apple. If a structure is near to the skin, we name it superficial. And if the depth is very deep and far to the skin, to the surface, we name it deep. Okay, it's superficial and deep. We use this pair term to describe the depth of a incision. For example, the operation will make an incision along the skin, superficial or deep. And this pair is internal and external. You see the picture is our one part of our intestine, small intestine or large intestine. And you know the small intestine or large intestine, they are hollow organ. Hollow organ is a tubule, and it's very like the blood vessels. It's also a hollow organ. And if one structure in the hollow organ, we name it internal. And outside, if a structure is outside hollow organ, we name it external side. Okay, for example, the blood is bleeding in the blood vessels, and if the blood vessel is broken, some blood will go out from it, will go out to the external side. Okay, now I will introduce about the terms of direction on our body. And this term is according to the bones on our body. First one, proximal and distal. What's proximal? What's distal? For example, is the bone of our body. This one is humerus. And these two bones is ulnar and radius. If one bone is closer to the trunk, here is our trunk, scapular, okay. If one bone is close to the trunk, we name is proximal. For example, the humerus is proximal on the upper limb. And ulnar and radius, they are on the distal to the trunk. Okay, Here is proximal, close to the trunk. Here distal is far to the trunk. Okay. And in the forearm, there are two bones. The medial side is ulnar. The lateral side is radial. We name the medial side is ulnar. You know what's the medial? The medial means close to the median line. Here is the median line. So this one is medial side, and the same time is ulnar side. The lateral bone is radial, so we name it lateral side or radial side. Okay, now you see the like. In our life, there are two bones. Two bones. The medial bone is tibial. The lateral bone is fibular. So we name the medial side is tibial side. The lateral side is fibular side. Okay? And these three pairs of terms also used to describe the direction, the spatial relationship of the upper bones and the lower bones. Okay, now I'll introduce you about the axes in our body. We use to describe the body, so I'll give you three axes in our body. There are three axes you see on the picture. There are three different colors. First one, sagittal axis. Sagittal axis is the blue axis or the blue line, and this axis is from the anterior to the posterior. This direction is this line, from anterior to the posterior. We name this one is sagittal axis, and this axis is very like an arrow. You know the arrow, the arc, the arrow. When you want to shoot arrow, and the direction of the arrow is from posterior to anterior, or from anterior to the posterior. In the first axis. The second one is coronal axis. The coronal axis is the green line from left to the right, from left to the right, and is parallel with our face from left to right. And the third one is vertical axis. This one is the right one, the right line from the top to the bottom. Vertical, a vertical axis along our body. What's the use of the three axes? Now let's continue to see. According to the three axes, we can name three planes. What's the three planes? First, sagittal plane. Second, coronal plane. Third one, horizontal plane. Now first let's see the sagittal plane. Sagittal plane is the blue one, the blue plane. The blue plane, sagittal plane is, just now I introduced, there is a sagittal axis from the anterior to the posterior, and this plane is according pass across just this line, and from the top to the bottom, this surface. First one, sagittal plane, and the second one, coronal plane. This one, the pink plane, and this plane along which axis? Yes, along the coronal axis. And the third one is horizontal plane, the white plane, and this plane will cross coronal axis and sagittal axis. The two axes cross each other and will form the horizontal plane or transverse plane. And what's the use of the three planes? Oh, you know, in future we'll study many organs. And for example, the heart. The heart, in different direction, you see the heart is different. For example, when you see it in front of it, on the back, on the superior, on the posterior, inferior, superior, it's different. So we'll name some different plane to this character. For example, along this one is sagittal plane. You see the heart, water structure. On the left and the right side, you can see the sagittal section. And here you see is the coronal plane. You see the heart. And this one is horizontal plane to see the heart from the superior or inferior part. Okay, in future we'll see different organs on different planes. Now let's see them again. This woman, this position, what's the name of the position? Yes, anatomical position. First is the erected body, and then face forward, palm face forward, toes face forward, and two upper limbs hung down beside of the trunk. Okay, then you can see there are three axes. This one from anterior to posterior is, now let's draw it, this one. What's the name? Yes, sagittal axis. Was this from left to right? Corner axis. Okay. Third one from top to the bottom. Okay. This one is vertical axis. Yes, the three axes and can determine three planes. First plane, this one. You see here. Okay. This one is sagittal plane. Yes, sagittal plane. And from left to the right, this one plane is coronal plane. And now you see the transverse or horizontal plane. Okay, it's three axes and three planes. Okay, let's continue.